My name's Ariel. I'm going to be your nurse today. Can you tell me your name and birthday?
Meghan, Buckler, 12/29/1995.
Okay. And I'm going to wash my hands. Okay, I have adequate lighting. I want to make sure I have that and provide privacy. And I'm going to have you lay down first. Are you going to be comfortable like that? Okay. Alrighty. And first, I'm going to palpate your carotid arteries, the arteries in your neck. And if my hands are too cold, just let me know. And I want to grade those bilaterally. They're 3+ bilaterally. And I'm going to listen for bruits in the carotid arteries. It's a swishing sound. There were no bruits auscultated in the carotid arteries. And next I'm going to check for JVD. You want to make sure that your patient is at 30 to 45 degrees sitting up before you do that. Can you turn that way for me? Okay, another way. Okay, no JVD observed. I'm going to roll up your sleeves a little bit so I can palpate your skin. Okay, and tell me if my hands are too cold or anything. I'm going to feel all the way to the fingertips and all the way to the toes. And so I would say that your skin is tan with pink undertones. It's smooth, warm and dry, slightly cooler at your hands and your feet. There's no presence of hair on your feet and toes. And I don't see any varicosities or inflammation in your extremities, so that's good. I'm going to compare your pulses. So I'm going to start out at the radial pulse in your wrist. Your radial pulses are 2+ and symmetrical bilaterally. Your dorsalis pedis pulses are 1+ and symmetrical bilaterally. And your posterior tibial pulses are 1+ and symmetrical bilaterally. Can you point your toes toward your nose and tell me if your calves hurt? Yeah. Okay, so we're checking for DVTs when we did that. Alright, and I'm going to listen to your heart. And make sure to keep you covered as much as possible when I do this. At the aortic spot, when we're listening, the S2 heart sound is louder. And while you're at the aortic spot, we're going to go ahead and just get the pulse here as well. Okay, and her pulse at the aortic spot was 70 and regular. So we're going to move over to the pulmonic spot. S2 is louder and there's no extra heart sounds. There wasn't any extra heart sounds at the aortic spot either. We're going to move down to herbs. S1 and S2 at herbs are equally loud. I don't hear any extra heart sounds. At the tricuspid heart spot, S1 is louder. I don't hear any extra heart sounds. Okay, I'm going to lift up your shirt for just a minute and listen to the mitral spot. I'm going to try to keep her covered as much as possible. At the mitral spot, S1 is louder. I don't hear any extra heart sounds. While I'm here, I'm going to lift up. And I want to look at point of maximal impulse for lifts and heaves, and I don't see any lifts and heaves. We're also going to listen for murmurs. No murmurs auscultated at the mitral spot. I'm also going to have you turn on your left recumbent side to just get a better listen for that. No murmurs or extra heart sounds are auscultated at the mitral spot. I'm going to go back up and listen to the other heart spots for murmurs as well. No murmurs auscultated at the tricuspid spot. No murmurs auscultated at the herb spot. No murmurs auscultated at the pulmonic spot. And no murmurs auscultated at the aortic spot. And now I'm going to raise up your shirt and look at your stomach. Okay, so I would say that your abdomen is flat. There's no lesions, striae, or varicosities observed, and your umbilicus is inverted. And so now I'm going to listen to your bowel sounds. Start in the right lower quadrant. And we're going to use the diaphragm. Bowel sounds were auscultated in all four quadrants, so now I'm going to listen to your aortic, renal, and iliac arteries. And so for the aortic, I'm going to go about right here. And we're going to use the bell to listen for bruits. So no aortic bruit auscultated. Now we're going to go renal. There were no renal bruits auscultated. Now I'm listening to iliac. No iliac bruits are auscultated. Now I'm going to palpate your stomach. Just let me know if anything hurts, if anything is really tender. First I'm going to do light palpation, and that is just a one-hand palpation method. And actually, I'm going to have you bend your knees. That way, if your stomach's a little tight, that will help me be able to feel better. I'm going to start in the right lower quadrant, and I just want to make sure I feel in each quadrant. Anything hurt? Okay, upon light palpation, there were no masses or no deformities palpated, and there was no tenderness. I'm going to do deep palpation, and that's a two-hand method. Let me know if anything hurts. Okay, any tenderness?
No.
Okay, upon deep palpation, there were no masses, deformities, or tenderness palpated. And put your shirt back down now. Alright, and I'm going to have you sit up on the side of the bed for me. Okay, are you comfortable sitting up? Alright. Alrighty. And first, before I do anything else, I'm going to your lips. They're pink. Can you open your mouth for me? Look at the buccal mucosa. It's pink and moist, so that's good. And I'm also going to look at your nails. Your nail beds are pink. I'm going to check for capillary refill. And that's less than 2 seconds, so that's good. And we're going to look at your nail angle. And it's less than 160 degrees, so that's what we want. I'm going to listen to your heart again. Now that you're sitting up, and I'm going to have you leaning forward a little bit. It's important to listen to the heart laying down on the left side and sitting up, so we hear everything we can possibly hear. Okay, the aortic site, S2 is louder. Pulmonic, S2 is louder. At the Arab site, S1 and S2 are equally loud. At the tricuspid spot, S1 is louder. I'm going to go up under your shirt for just a minute. And try to keep her covered as much as possible. The mitral spot, S1 for the mitral spot, we're going to go up under the shirt. And S1 is louder. And I did not hear any extra heart sounds in any of the heart sites. And now I'm going to listen to your lungs. I'm going to have you take deep, slow breaths. If you get lightheaded at any time, just let me know. Alright, I'm going to listen to your lungs. I'm going to have you breathe through your mouth. Slow, deep breaths. If you get lightheaded, just let me know. And we're going to start above your clavicle. This will be bronchial breath sounds. So take a deep breath for me. Okay. I'm going to move from side to side because we want to compare each side. Okay. Deep breath. Deep breath. Deep breath. Deep breath. Are you feeling okay? Okay, I'm going to go around to the back. And on the back, you want to make sure you start at the apex. We want to start at the very top of the shoulder. You want to make sure you're not listening over a bone as well. Deep breath. And also compare side to side. Deep breath. And as you move down the back, you want to feel where the spine is and the scapula, and just make sure you're in between them and not over a bone. Deep breath. Deep breath. You still feeling okay? Okay, deep breath. Deep breath. Okay. Now lift up and go up under your shirt. You want to listen to the whole lung, but make sure you stay within the rib cage and how far down it goes. You don't want to go down too far. Deep breath. Deep breath. I'm going to go over and listen to the side of the lungs as well. Make sure that we stay up higher so we're in the rib cage. Deep breath. Okay. Deep breath. And go around a little bit more to the front. Deep breath. And one more time on this side. Deep breath. Okay, do you still feel okay? Alright, lung sounds were clear anteriorly, posteriorly. I'm going to go up on the sides. We're going to go a little further up and make sure we listen to the front on the side, the lung. We don't want to miss that part. Go a little bit forward. Deep breath for me through your mouth. Okay. And we want to go to the other side and do the same thing. Okay, deep breath for me. Okay, so now listen to all the spots. I can say that the lung sounds are clear anteriorly, posteriorly, and bilaterally. Also, I'm going to look at her chest and the side, and I can say that her anterior posterior diameter is less than transverse diameter. And earlier, we listened to the heart sounds while she was sitting up. I'm going to go back now and listen to her murmurs. I'm going to start down here at the mitral spots. I'm going to lift your shirt up. No murmurs, auscultate at the mitral spot. Now I'm going to go down through the top of her shirt. Listen to the other four. No murmurs, auscultate at the tricuspid spot. Let me go up to herbs. No murmurs, auscultate at the herb spot. Gonna move to pulmonic. No murmurs, auscultate at the pulmonic spot. And aortic. No murmurs, auscultate at the aortic spot. Okay, are you still comfortable? And now we're going to do a muscle strength test, if that's okay with you. I'm going to have you put your arms out to your side. Just don't let me push them down. Don't let me push them up. Okay, can you hold them out like this? Don't let me push them in or out, down or up. And put your fingers out like this. Don't let me close them. Okay. Get me to move this so you can see. Don't let me push your legs back or forward or in or out. And so her muscle strength is good. I would say it's a 5+. And do you know where you're at right now and what time of the year it is?
It's late summer, Cumberland University Nursing School.
Okay, so I would say that you're alert, you're able to follow commands, you're oriented to person, place, and time. Okay, and I'm going to look at your pupils. Just look at my nose. Okay, and look at my nose, and I'm just going to test your pupils and see if they consent. Looking at the first pupil. Now I'm going to look at her other pupil to see if it also constricts, and it does. I'm going to do the other one. It constricts. and the other one does consent, so pupils are equally round and reactive to light and accommodation. And can you puff your cheeks and smile and lift your eyebrows? And so since you can do all that without any problems, your cranial nerve 7, the facial nerve, is intact. And can you close your eyes? We're going to do a sensation test. This is what it'll feel like if it's sharp, and this is dull, so you just tell me what you feel when I do it.
Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull.
Okay, so I would say sensation is present and intact in your upper and lower extremities and symmetrical bilaterally. Alrighty, do you need anything else right now? Alright, you can lay back down and you just call me if you need me, and our bedside exam is done.